We have a worrying new snapshot tonight of the crisis across Canada's healthcare system. A new report in Ontario shows how exhausted and burned out nurses are amplifying concerns that staffing shortages will compromise patient care. CTV's Allison Bamford has more.
Stretched thin with an overwhelming workload, morale is deteriorating across Ontario's healthcare system.
The conditions that now are breeding such discontent that are causing, nurses to flee.
The findings of a new study based on interviews with Ontario healthcare workers. Identities kept anonymous, but the problems they face are clear.
We hardly have time to take breaks or go to the washroom. I don't think that patients are getting the care they need.
Researchers say the growing staffing crisis is putting the well-being of workers and patients at risk, a problem that predated the pandemic.
Over time, this just corrodes people.
The concerns echo survey results from Saskatchewan released last year. 62% of registered nurses there considered quitting the industry, and 92% said working conditions negatively impacted their mental health, something BC nurses are also seeing.
It's just not a sustainable formula for one person to be providing care for 12 to 16 acutely ill patients.
BC is the first province to introduce a minimum nurse-patient ratio. When rolled out in the fall, there will be at least one nurse for every 4 patients in medical and surgical units.
It's a win-win for the nurses, the profession, and for the patients. They endure less workplace injuries, there are less medication errors, and there are less hospital-acquired infections and less readmissions to hospital.
Nurse-patient ratios don't exist anywhere else in Canada, but are set up in California and parts of Australia. Earlier this year, Ontario voted down a bill that would have introduced a similar practice. Allison Bamford, CTV News, Regina.